Emergency departments are always a very high risk point. There's a lot of activity going on. People are coming in who are very sick. And you have a triage nurse in the center of all of this needing to make decisions very quickly.
Triage is a process where we figure out if you're a big sick or you're a little sick. And what that involves is asking you a series of questions and also taking your vital signs, which includes your blood pressure, your heart rate, your temperature. They're objective symptoms that we see. So we take that information with what you're telling us, and we go ahead and we can see if maybe you are suffering from sepsis at that time. But also we have a tool that we've had in our emergency department that is very unique to us that's called KATE.
So the KATE system and the use of the automatic intelligence is really like a person who has that triage nurse's back. And so the nurse goes through their normal triage process, puts in all the information, assigns a triage acuity level, and then KATE within a couple seconds will come back with an alert to the nurse if their reading of everything she put in is a little different. So really helping us protect the patients who come to our emergency department and ensure that they're getting the best care they can, no matter whether there's 100 patients in the waiting room or there's 2.
We've already deployed KATE in our department to look at triage, because that is what KATE was built for, is to better standardize triage and more accurately triage patient. And I went back to them and said, we've got this bundle that we're trying to do within 1 hour. So we really need to identify them the moment they walk in. Can you build a model using KATE's database of several hundreds of thousands of patients and find some patterns that help us identify sepsis earlier? And they took several months. They built a big model and found out that they could actually identify sepsis about twice as good as the best tool that we have right now, which is just 2 SIRS criteria and a historical source of infection.
I think that a organization that is investing in something like KATE means that the organization is invested in the education for their staff as well as investment into their patients.
Triage nurses are one of the highest burnout rates of any nursing position. And with KATE, our triage nurses tell us that they don't feel that stress that they used to feel.
KATE is a great tool. She's not the answer. She's not meant to replace any triage nurses. We tell all my nurses that you are the expert. You're there, you're touching the patient, you're seeing the patient, and you have all the unknown variables that you bring to the encounter. And KATE is a tool. And she's been here up and running for almost 3 years now. After seeing what she's done, I think every hospital in the country should use this.